Hi, everyone. Welcome to another episode of Behind the Smiles. Today, I get to interview someone that I am very, very proud to have as a friend and my online buddy and a fellow dentist, Dr. Paul Etchison.
Thanks, Tina. Glad to be here.
Well, thank you for carving. I know you're very busy, so thank you for carving out some time to be with us today. Dr. Etchison is practicing in Illinois, and he recently just published a book called The Dental Practice Hero, which is something that I want to talk about because I really enjoy reading this book. He also has a podcast by the same name. And today we're going to kind of go back and figure out how all this came about. So my first question is the book.
Mhm.
I want to talk about the book first because I'm really excited about it. And, I've been told before that I should write a book, but I don't have time for this. So my first question to you, how do you find the time? You have a family, you have
Yeah,
a practice, you're very busy. How do you find the time to write a book?
you need to have a very patient spouse. That's step one. I always joke about it. I tell people is that what's crazy about it is once I came up with the skeleton and the outline and everything, it just didn't take that long to write it. I mean, I was probably doing about 3 hours a night for maybe 16, 17 nights. Like took me like 3 weeks. I did it very fast. I mean, it was over the course of like 2 years it took to write because I kind of set it down for a year and a half. But when I actually got really focused on it, I wrote it pretty quick. And I always joke with my wife as I tell her, like I wrote like a 10-page research paper in college that took me like 3 days to write. And then I could write this 270-page book with no problem because it was actually something I knew about rather than something I was like researching and not very interested in. But it was a great experience. It was fun. I almost want to do it again, but now I'm like kind of going to different projects and doing different things and a little bit more involved with the practice. So maybe another book someday in the future, but for now, happy with what came out of it. And I think it turned out good. And it was just a great experience.
So the book is sort of a documentary of what happened with your own practice startup. And it's full of amazing information, gold nuggets that everyone, anyone who is trying to start a practice, anyone who is already in practice, everyone should read this book because it just has those, practical pieces of advice that we all need. And even, I've been in practice for 17 years now almost. And there were things that when I read this book, I said, you know what, I should revisit that. I knew about this somehow, somewhere, but I forgot we're not practicing this now. And so the book is absolutely amazing. But what I wanted to ask you is, what was the motivation for writing this? Like, because you kind of just took everything out of your head and then you put it on paper.
Yeah,
and I love that. But what motivated you to do that?
So I was an advertising major, and one thing I learned on advertising is that I actually just recently did a podcast about this, that like every little thing matters, and when you plant these things in people's brains, almost like the Malcolm Gladwell book Blink, we have this bias and we just don't realize it's there. So originally I wanted to write like a 3-page thing. This is our brand at the practice. This is who we are, to give to new employees. And when I started typing it, it ended up being like 22 pages. And it was the same thing. Like I said, it just typed it really quick because I wanted to put everything I wanted a new employee to understand about my brand and my business. And after I did that, I was like, gosh, maybe I should write maybe like a 50-page like training thing for like assistants or like for front desk on like attitude and branding and all this stuff. And then like it just turned into like, dude, just go for it. You can totally do this. And it just evolved like that. It was kind of serendipitous how it happened, but that wasn't my intention. But that's where that brand book started, and that's where it ended up.
I want to talk a little bit about your practice, because what's really unique about you is that, and a lot of our listeners are new startups. And of course, when you started your practice, you were just out of the gate. I understand you were just over $1 million in your first year.
Yeah. We did just over $1 million our first full year. Our first full year we did, I think, about 950. Our first full fiscal year was a little over $1 million, like 1.3 or something like that.
That's incredible. That is absolutely incredible. We don't hear those kinds of numbers often enough. What do you think was the catalyst? Like what made it happen?
I think what made it happen has a lot to do with our block scheduling, but what allowed us to schedule that way and to do that much production with just me and the hygienist was my team, like training my team. I let my assistants do as much as the law will let them and maybe a little bit more. I had the same assistants that I've had 7 years ago. And we just always worked on things. We always said, how can we do this faster? Hey, let's talk about when we're doing endo. Like, can you pass me this? Can you already have something ready? Like, we got really systematized about how we did procedures. And I just started letting them learn. I mean, just like when we're in dental school, like, I don't know how to do this. We're like, just go do it. And then we're going to talk about it. And then we're going to see what went good and what didn't go good. And then what we can work on. And it takes the right type of assistance, but I think it takes the right type of leader as well to trust them to do this, because I think that people sometimes want to shoot me for saying this, but I think a lot of what we do in dentistry can be taught. Like, it's like, you don't need 4 years of dental school to learn how to adjust a crown or something, or adjust a proximal contact. You know what I mean? So I let them do everything. I mean, for instance, for example, the crown deliveries, I'm going in the room when it's ready to put cement inside. You know, I don't even try it on. And I'm at the point now where I trust them. And I trust that it's perfect. And if there's an open margin, they'll do the right thing. And if they blow out of contact, they'll tell me, or they'll usually, if we're doing EMAX CEREC, they'll go bake on some more porcelain before they come get me. So I think a major catalyst, major factor is using my team. It's all team. Like, you can never, it's everybody combined that gets you great numbers and those great results. And it's hard to do it alone. So I would say team.
You said a couple of things that are extremely important. I want to revisit each one of them. You said you had a great team,
yeah,
that you trust, and you had systems.
Mm-hmm.
This is really what being an entrepreneur or a business owner is all about, right? So let's talk about the team. How do you hire people that you can trust and delegate to, and know that when they, and this is a big one, when they mess up, they can come to you? How does all this happen?
Yeah, I don't think I have anything magical with hiring. You know, I've always, every time we've had a position open, I've never been excited about everybody. And then one person will come through the door and I'm like, that it's her. I know it's her. It's like, you just know it immediately. And they tend to just be people that I like to talk to. You know, I don't ask all these tricky interview questions or go see how clean their car is, I've heard people say, or I do maybe stalk their Facebook a little bit just to be sure. You know? But I've been very good with hiring, and I've been lucky in the sense that 7 years, we've not had a single turnover. Like, we still have everybody we've always had. So trying to think, what did you ask me? I'm getting caught off your question here. Oh, I know what you said. How do I make them feel safe? Yeah. So I always, that's something that I always say is really important, is having that psychological safety, because if they're scared to mess up and you make them feel really bad, they're not going to want to mess up, and they're going to be doing the bare minimal. They're not going to run with it. They're going to be scared to take a leadership role because they're worried about if they screw it up. So that's something that we always say at the practice, is we say grace over guilt. And sometimes someone will be like, you know what, you're making me feel real guilty about this. And I'll say, you know what, you're right. I'm so sorry about that. I shouldn't. But that's one of our practice mantras, is grace over guilt, and a culture of coachability. And it's so important, because if you want to lead by influencing people, that's how you got to do it. But a lot of us want to lead by fear, where we're, you know, because I said so, because it's my practice, I'm the owner. And I think that doesn't get great results. That can get results in the short term, but that's never going to get you long-term buy-in from your staff. So, and I tell you, when people come into my practice, they feel that with my whole team, that everybody loves working there and everybody's working towards a common goal, and we really like what we do. So that's probably foundational to having a great team.
You know, that's so true. When you come into a practice, the culture is palpable. You can feel it. Every team has a culture, either something that you painstakingly built, right? Mm-hmm. And then you kind of nurture it over time, or it's something that happens spontaneously as a result of the people and the attitudes on the team.
Mm-hmm.
And you always know what the culture is. And I love what you said about grace over guilt.
Mm-hmm.
I mean, that's really, this is what Simon Sinek is talking. I know you're a reader.
Yeah, I read it.
What
Yeah.
Simon Sinek is talking about in his book Leaders Eat Last,
Mm-hmm.
and making sure that your team feels safe, and I think it's incredible that you are leading your practice with that, you know, with that mind. And I know that it's very difficult to, we all want great employees, but it's very difficult to build a great team if people don't want to work there because they don't feel safe, right?
Mm-hmm.
And those employees, the A players that we want, they need to know that they're safe and that they can speak up and they can stand up and they can take a chance, and it's huge, and that, I'm sure that's a huge part of your success. Let's talk about the other part that you mentioned. You
Mm-hmm.
were talking about systems. Tell me about your systems.
So I say in my book that if you have great leadership and that's going to create a great team, that's going to create the great system. A lot of people want to ask, like, what is your system for this? What's your system? And I'm happy sharing things, but I literally believe, I sincerely believe in my heart that if you've got a great team that likes to work together, that those systems just happen, because you're always talking with your team. What can we do better? What didn't work? What happened? We pissed off a patient. How can we do this so it never happens again? You just create the system. So we've gotten to a point where we're 24 employees now. It might be 25. I have no idea. We're growing like super fast right now because we just expanded from 5 to 11 ops. But we've been in the process of kind of getting a lot of things in writing, which has been good because I think it helps us be consistent. But it's almost necessary, because that's our struggle going forward, is that, can we keep this culture going with a larger team? And where I associated at when I got right out of school, we had a big team, but it was not a great culture. So that's always been my fear, is I don't want to have that practice. But as the natural evolution of my practice went, we just got so to capacity, we had to do something. And that's been my fear, and it's still my fear going forward. But it's something that's so critical to going forward that I really nurture it and I stay on top of it. But like I said, the systems, they come from that team. If you've got the culture, we'll come up with something. And it's just about being clear with everybody, communicating. A lot of dentists don't even have meetings or morning huddles where they can talk about these things. So it's about communicating, just like a good marriage or a good relationship, good friendship. You talk about your expectations and you work on things, as a team.
Absolutely. Absolutely. I agree. So, you've practiced, grown tremendously over the years, 24. Wow. How long have you been practicing?
2009. So upcoming May, it'll be 10 years.
Wow.
It's
Wow.
great.
Incredible.
Yeah.
Incredible. So let me ask you questions. Have you ever had a tough moment, like a really tough time during those 10 years?
Oh yeah. I mean, when we came out of the gate, maybe about 2 years in, when we were at the point where we were successful, and it was like, wow. And I took that yearly income goal and like doubled what I wanted to make, and pretty much had everything I've ever wanted, checked everything off my list, had the kids, had the family, great marriage, house and the car and everything. I kind of felt like a little like empty, like the rat racer, always getting the next goal. I'm gonna get the practice. I gotta do this. I do this so that I can start enjoying life. And then what I realized just by experience is that it wasn't about all those things or checking off those goals. And I think I could do it. I've learned this by experience, but I wish I would have enjoyed that journey a little more, because I really didn't. And I kind of missed out. My oldest daughter, she's about 8 right now. I probably missed a good 2 years of her life when we did the startup, because I was just so focused on getting that rolling. And now that we're going from the expansion from 5 to 11 ops, I'm seeing me get a little bit more off balance towards work again, because there's a lot to do, but I'm doing a little better this time than I did last time. And I'm making sure that when I come back to home, that I still have a home to come back to, What I mean? But yeah, that was a tough time for me. And it was a little depressed. Yeah, it was depressing. And I had to learn a lot of things about myself and just the way my brain is wired, this entrepreneurial, just go-getter, goal-setter, and just executor of everything. I had to slow down. So I try to stay a little bit more balanced now, but every now and then I need to be checked. So.
Thank you for sharing that, because, talking about your tough times is part, right? And admitting that that we're not perfect, and you know, that balance, that elusive life work balance. What advice would you give to another dentist who might be in that place, you know?
Well, my advice that I would say is I don't think there's anything, you don't have perfect. There is no perfect. And I think it's Gary Keller in his One Thing book talks about middle mismanagement. And if you had the perfect life-work balance, your life wouldn't be that great, or nor would your work. Because you go way out of balance to kind of do, you know, it's like there's different seasons. So I guess my advice would be, I mean, the goals, I mean, it sounds cliche, just enjoy the ride, enjoy the journey, but easier said than done until you actually like hit like a bottom point where you're like, oh my gosh, I didn't enjoy any of that journey. I was working too hard. But yeah, I think you do have to go out of balance to do great things. And it's okay to go out of balance towards work for a little bit. You just have to come back and then spend more time at home and then back. Right now I'm at home. I'm off all week. And this is actually the highlight of my day, Gina. So thank you for that. Yeah.
Let me ask you a question. What drives you? I mean, you know, you're obviously a very motivated person, and
Mm-hmm.
and you've accomplished so much in such a short period of time. What drives you?
I like to set goals. I like to be moving forward. It's just like this ambition towards just the next thing. And I had a coaching call with a real estate guru on Monday, and he said, because I'm really starting to get into multifamily real estate. And he says, well, why do you want to get all these doors? Like, why do you want to get so much cash flow that you're financially independent? I'm like, I don't know. It would just feel different to be financially independent. He says, well, then what you going to do? I'm like, gosh, that's a really scary question. I wouldn't be able to sit still. So then I always had this reality check, like, okay, stop. It's almost like what I was just telling you about what got me in the trouble in the first place. Now I'm doing it with real estate. I'm like, okay, I gotta get 50 doors by the end of the year. And I don't know. Sometimes I think I need to go talk to somebody about my brain. It's not wired right.
You can always talk to me because I can certainly relate.
Yeah. Well, I can tell you this. So I'm a 3-day a week. All right. I'm 3 days a week clinical. I did this about 3.5 years ago. And I was like, this is great. I'm going to have more life balance. I'm going to spend more time with my family. I'm going to do all these things. And then I started writing the book. And then I started the podcast. And then I started getting into real estate. And then I'm like, I work out now more than I did 3.5 years ago when I was doing 4 or 5 days of clinical dentistry. So yeah, it's a struggle. But this is going to be my first year taking 12 weeks off of vacation. So I'm excited about that. I'm not going away every vacation, but it gives me time to kind of decompress and just do a little bit of work, which I've been doing all week that I've been off. I've been doing a little work, but I'm not breaking my back by any means.
That's incredible. So this year we did something different. We took 4 weeks and we went to Maui.
Oh,
And
wow.
you
4
know,
consecutive weeks, huh?
yeah, it
Wow.
was 4 consecutive weeks.
That's
You know,
awesome.
I still had to work. I did some podcasts, you know, I wrote for the blog, but I made a deal with my office manager. I said, look, I'm not going to call you. I'm not going to check on you. If you need me, you call me.
Mm-hmm.
So she called me once to ask me if she can hire someone that she found for the front office, because I had someone who was actually who moved to Seattle. She now works for Yapi, but
Mm-hmm.
you know, she moved from my dental office, and and that was it. And you know what? The office didn't. It still exists. It did
Mm-hmm.
fine. Nothing happened. But I want you to talk about this. How do you take vacation? Because your office, obviously, your practice is younger,
Mm-hmm.
and you know, I hear so many dentists are worried about taking a week away
Yeah.
from the office. So talk about how you take care of your team while you're away, what it is that they do,
Mm-hmm.
and how do you trust them to not run it into the ground when you're not there?
Right. Yeah. Good question. You know, when we first opened up, I think the first year we opened, I took maybe 2 or 3 weeks vacation. So it wasn't a lot, and these were all separate. Um, it wasn't until about 3 years in, I took, I think, 7 weeks of vacation. And that was still tough because I didn't have an associate. And then, and you can't think about it in the way that when you're producing $40,000 a week, you can't think of it like this is going to cost me $40,000 to take a week off, because that's just going to ruin it. So, um, I've always been of the mind that when I go on vacation, which was a lot, it's more than most people, I think, or when I'm not in the office, I should say rather, I tell my team they can still come in the regular hours. They are welcome to take off because there's not much to do when I'm not there, but I still want them to come in. when I was in dental school, my wife was a hygienist, and she was working for someone who kind of took a lot of vacation, tons of vacation. She was a 3-day-a-week dentist, and I think she took about 12 weeks of vacation, sometimes 2-3 weeks at a time. And when we were we needed the money, and it was really hard on her to not be able to work when the dentist wasn't there. So that was something I always said I never wanted to do with my team. So they go there and they do reactivation. They organize supply closets. They find things to do, but you have to trust them. You have to set expectations, and you have to kind of just take the leap, because I think that's the hardest part for most dentists, is that they think they're so absolutely necessary that they don't realize when they go away that they might not be as necessary as they think they are. You know? But then another thing is too, is you can't be the answer guy. And I've kind of trained my team to, like, do you really need me to do this? You know, and sometimes they'll come to me a question. I'm like, what do you think I would do? They're like, I don't know what you would do. That's why I'm asking. I'm like, well, what do you think I would do? And they're like, I think you do this. I'm like, well, why don't you try that? Well, is that what you would do? I don't know. But if it doesn't work, we'll talk about it. If that's what you think we should do, just do it. So you just start giving people the just letting them do things. And then if they screw up, you don't chew them out, like we talked about earlier.
Absolutely. You know what? This is so critical, because so many of us are stuck in that mode where we're the go-to person. It's like we don't have employees. We have task rabbits, right? Yes. We give them a task. They do a task. If they have a question, they come to us. And we're the bottleneck. We are the ones who are slowing everything down. We're answering all the questions. We're fighting all the fires. And we're switching those hats really quickly, because we are afraid to let them make their own decisions. And they're afraid to make decisions. But when you do what you just described, when you ask them what you would do and they get it right, all of a sudden you just teach them that, hey, I can make decisions. Yeah. I know what I'm doing. If Dr. Bull is not around, I am a big girl. I can make a decision.
Yeah.
And that's critical. That's half of it is half of the ability to take vacation and be away is an employee who knows that she can make a decision, and the other half is making sure that she doesn't get chewed out.
Yeah, and sometimes when you go away, you come back and you're like, why didn't anybody call me this whole week? It's like you get a little you're like, don't you guys need me anymore? And then you start getting insecure about it, Yeah. It's the truth. And like you said, switching all those hats, that is emotionally exhausting. I mean, we do it when we're doing dentistry, going from exam to a filling exam to a root canal I do ortho and implants and all that stuff. And you put on so many different hats that some days when you're really busy and you're running at full speed, you're just worn out. And then you pile on top of that a million questions or things that your team is asking you to do. It just wears you out. And I think that's where that burnout starts, is when you just get a little bit. It's so de-stressing to have a team full of leaders that'll take the ball and run with it.
Oh, absolutely. Absolutely. So have you ever felt burnout?
Oh yeah, big time. Yeah, I actually, I was on a podcast not that long ago saying that kind of the clinical has just been kind of burning me out lately, and I've actually, these past 2 months have been a lot better though. But I think I've gotten to the point where I think we were talking about CE and what kind of CE I was taking. I'm like, I haven't taken a clinical CE in I think over 2 years, and it's just so strange for me. But I not to say that I'm perfect, I just haven't really heard anything amazingly new that I haven't heard before. I'm a lot more on fire about like the entrepreneurship and the practice management things. But yeah, I think I was getting pretty burnt out on just day-to-day dentistry, fillings. Now I've got 2 associates who've got openings in their schedule, so they take my fillings, which is really great. Probably do like 1 filling appointment a day now, I love that. I'd like to get to the point where I'm only doing orthodontics and implants. That's what I want to do. So, but it's hard not to do the same day-to-day stuff and get run down. And especially we're dealing with people. We deal with crazy patients, and we deal with sometimes staff issues that keep us up at night, to say that nicely. But yeah, I struggle with that as well. But there are times like right now, I'm loving it. I'm on fire. I'm excited about the expansion. We could see where I'm at in a year. We don't know. You always got to be growing, and I always got to be doing different. I get bored easily. Yeah.
I can certainly relate. So, I mean, you sound like you've just had a hell of a ride. I mean, it's just, with your practice, your podcast, your book. What do you attribute your success to?
Oh man, I don't know. I think it's just an underlying belief that I can do anything that somebody else can do. And my wife always gives me a hard time about that. She's like, "You think you could do everything?" And I'm like, "Well, I just feel like if I applied myself and I had the right resources, I could." So I think it's just believing that if it's been done before, I can do it. And a lot of my success has been CE related, and not so much from the speaker, but from just networking and talking to other people that are successful and finding out what they're doing. There's always something that you can learn from somebody. I think there's like a Ralph Waldo Emerson quote. It's like every man I meet in my walks is my superior in some way. I just have to figure out what it is or something like that. But it's true. It's just learning and implementing new things. It's not as hard as you think. You just got to talk to the right people and actually execute on what you learn.
Good point, because a lot of people go to CEs, read books, hear great ideas, and they don't implement. What advice can you give to someone who's having a hard time implementing things in the practice?
Well, I am a big believer in writing out goals. I think when you put it on paper, that's when it becomes real. And I do think that's so critical to everything I've done, even writing big goals. And I just like reverse engineer them back, break it into smaller goals. So I think if anyone's having trouble implementing, I go through notebooks like crazy, and then I just throw them away because they're just scratch pads for me. Just to like kind of like organize my thoughts. Yeah, write them down. That's so important for me.
Very true. Very true. It's funny you mentioned notebooks.
Mhm.
As paperless as I am, I have to write things down. I love my notebooks. I have different notebooks for different, projects, and I write a lot.
Oh, you see, you're
Um,
more organized than I am.
you know what? I have to be
I have
organized. I'm
I
crazy
have just this
organized.
mess right here. That's my mess right now. It's about full. It's got my daughter's name on it. Sometimes she comes in and she's like, "What are you using my notebook for?" I'm like, "I couldn't find a new notebook." I tell you.
Let's talk about your family. You have two kids, right?
Yeah, two girls. My oldest is almost 8, and my youngest is 3.
What are you excited about as far as the family right now?
Oh gosh, my oldest just started a competitive cheer, and I
Oh, wow.
really wanted her to be a softball player because I played baseball, and I wanted her I coached her softball, and she was just kind of timid and scared to swing and scared of getting hit by the ball. And then she kind of went this gymnastic route, which has been fun. And then she went to cheer. And I'm like, oh my gosh, anything but cheer. And then like we had our first competitive cheer competition, and I'm like, cheer dad, I'm like loving it. I can't get enough of it right now. So, so then we've had 2 competitions. We've got one on Saturday, and we've got first place in both of them. And like I'm talking to the other like parents around there, and I'm like, you know what? This isn't about them having fun anymore. Like I want to freaking win now. Like this is serious. Like 7 and 8-year-olds. And so
No
yeah, but
pressure.
she just kind of like fell into this. Something clicked in her athletically in the past 3-4 months, where a lot of the things in gymnastics and tumbling she was working on for almost 1.5 2 years, and she just figured them all out. So she's in this new era of athleticism that we haven't seen before, and it's exciting to watch her grow like that. And then my 3-year-old is very cute, but she's 3, and we're in that tantrum stage. And I love her dearly, but I'm ready for her to be 4. No.
My kids are a little older, and when we actually went to Hawaii this year, I realized how nice it was to travel with older kids because, for once I was at the beach and I wasn't worried about them somehow getting hurt, drowning or,
Yeah.
getting sunburned. I was just able to sit down and relax, and they were fine. They were doing their own thing. And I'm like, you know what? It's really nice when they're a little older.
Yeah, that's
Got bigger
awesome.
things to worry about. But
For sure.
does your wife still work as a hygienist?
So she works probably once every 3 months on a Monday night, and we have been planning when we did our expansion. The expansion is about 3.5 weeks old now. We were going to put her on every other Monday, just seeing kids. She was a pediatric hygienist for like ever while I was in dental school. For 5 years before I was a dentist, she was doing hygiene. And we didn't meet in the office. I always like to throw out that disclaimer because people say, "Oh yeah, I see what happened." I'm like, no. We were high school sweethearts, so we've been together for like ever. But we've been talking about her getting back into practice. Like she was taking care of the kids for a while, but she'd like to work more. And now we have the extra chairs available to do it. So that's probably something that needs to happen soon, but it's not something I've got done on my list. I got to write down. That'll get it done.
You don't write it down, it's not going to happen.
Yeah.
I got you already. I understand. Let's get back to your practice for a second.
Mm-hmm.
So you are up to 24 employees. You have 2 associates.
Mm-hmm.
For anyone who's listening who is curious about hiring an associate, what are your recommendations?
Oh, my recommendations would be, I think it's important. And I've been so lucky. I've heard associate horror stories, and that is just not either of my associates. They're both great. I think the scariest part for me was that nobody's going to do it as good as I'm going to do it. And that's just not okay. And I think you need to release that control and just say, you know what, you can't do it all the time. And we were at a point where we had so many patients that I needed help. You know, it was either that or going off insurances. And I didn't want to go off insurance at that point or get out of the in-networks. I mean, we're not on a lot of them now, but we're still in quite a few. You just have to trust that they can do it. But then it's a lot of, you know, listening to their exams. They listen to your exams, going through cases together, looking at their new patient exams, x-rays together, things like that, and just calibrating so that they diagnose the same as you, because it's very easy. You don't want to have, where I was at my associateship, you know, I'd see somebody and say they have 2 cavities, and then somebody else would say they had like 17. And that's not okay. I mean, we all know that there's difference in the aggressiveness of providers, but if you're going to be one organization, you need to be fairly consistent on your diagnosis. So calibrating, going through cases together, and just kind of mentoring. I mean, my first associate, she doesn't need a whole lot of mentoring. She had like 3 years of experience when she came out, and she just kind of ran with it. But she's comfortable talking to me about, you know, procedures that she's struggling with, and she doesn't do a lot of molar or endo, and she's trying to do more of that. So we're kind of playing with that a little bit now. But yeah, I think you got to relinquish control and just be okay with it not being you. Take that weight off your shoulders because it's so good when it comes off.
Right.
Yeah.
For me, it was kind of natural because I had no choice. I got pregnant. I had to, you know, even though I was trying to stay like, I'm not doing this. I'm not pushing this baby out of my body. This is just not going to happen.
Just hold it.
Yeah. But it had to be done. So, and when I remember this realization coming back to my practice, like, hey, nothing fell apart. Everyone is great.
Yeah.
Taken care of. This guy's doing great. And over the years, I've learned that there are actually a lot of people who can do it better than me.
Yeah.
But how do you find them? How do you identify that right person?
Well, where I'm at, 40 miles south of Chicago, whereas like literally where the suburbs end, right where my practice is, if you go like a half a mile south, it's nothing. It's just farm fields. So like the suburb ends where I'm at. And a lot of people say, gosh, you know, I'd love to work at your practice, but it's just so far from the city, because we're about a 45-minute drive from the city with no traffic and maybe an hour and a half with traffic. And it's tough to find people. I mean, I could say with both times I've placed ads places, and I don't think I've had more than 5 or 6 people apply. But I don't know if it's like some kind of divine intervention, but I always seem to find great people. Like they always just appear. And I should tell you now, we're hiring for front desk, and we've got like 4 people that we like. Like we've never had like multiple people. It's always been like, that's her. That's the only one. And now we have 4 people. We're having like working interviews because we like so many of them. It's tough, but yeah.
The struggle is real.
I don't have a recommendation for that because I just kind of lucked out, I think.
What do you look for in employees?
I look for somebody that can look somebody in the eye, smiles a lot, and is enthusiastic and can hold a conversation. That's about it. And I think that comes down to attitude too, because you kind of sense the attitude. And they're people that I like to talk to. So I tend to hire people that are a little bit like me. Everybody gets along fairly well, but it just kind of go on my intuition. And I had one that I hired maybe about 2 months ago, and I just didn't feel really good about it, but we really needed somebody. And I said, well, maybe she was nervous in the interview, and maybe I'll give her the benefit of the doubt. And then we let her go within 2 weeks. Cause like within 2 weeks that we're just like, I was like, you know, you knew this before you hired her. So I felt like a jerk because she had quit her job, and I ended up paying her like for a year, or I paid her not for a year, for a month. I paid her for an additional month because I felt so guilty about it, but when not making that mistake again. So trust my gut.
It's always, you know what, it's so true. Whenever you talk yourself into an employee, that person never works out.
Yeah.
There's something, I believe that like if you thought about it, you could probably write down specifically what you're looking for, but you kind
Yeah.
of know it. You're like,
Right.
I have to delegate hiring between Yapi and my office. I can't possibly hire every single
Right.
person. But I also have like my questions, and there's a system to this madness. But yeah, you just know. I think it's comes from within.
Yeah, I agree.
It's something like, besides the fact that it's like at the end of the um, earth, pretty much. Is there anything else that's unique about your practice that you think is attracting great people or great
I
old
just,
patients?
we just take great care of people. Our culture is just outstanding. I think that is what makes my practice very unique, is the culture. Um, like I said, thankfully, almost 7 years, zero turnover, nobody has left. And that's something I take a lot of pride in. And I think that takes a lot of, I've had difficult conversations. I've had to have a lot of difficult conversations that I didn't want to do, that I put off for 2 or 3 weeks sometimes because I didn't want to have them with people. But that's what I think it takes to be the leader and to have a cohesive team, is that you want to be able to talk. You have to be able to talk about things. We go really far into patient experience. We get really detailed with what we're going to do with patients. And that's from the way that where the chair is and what position the chair is before the patient comes in. It's all lined up, and because we don't want to walk in a room and move a chair so the patient can sit down. So like little things like that. The TV's on a certain station. There's no sound. I mean, we're very, very specific. And the things that we say, not so much as scripting, but they all have purpose. And I'll just say, for example, like I always ask permission to sit somebody down. I always say, is it okay if I lean you back? And they always say, yeah. But it's like those little things always make that big difference. So, and you'll see it on our Google reviews. I think we're up to like 505
Wow.
now. And to talk about associates, this was brought up at our last meeting. I started noticing that I'm not getting any more 5-star reviews, and everybody else is. And I brought it up in the meeting. They're like, "Oh, you a little insecure?" I'm like, "Yes, I am being very insecure. Like, what am I doing wrong?" Yeah, but I think what it is I just don't see as many new patients anymore. Who knows? But yeah, we provide a great patient experience, and that's what has allowed us to grow to the level and numbers that we have, just because we just get a lot of referrals and it just goes.
So do you have all of that written down and documented in some way, like the way that you ask for permission, the way you position the
Mm-hmm.
chair, the TV with the sound off? There's actually like a manual, a playbook.
We do. We call it a movement sequence, and we have quite a few of them. We have them for new patient check-in. We have one for suture removal. It's the way that we do the procedure, and it makes everybody be consistent. And there's a reason for all of it. Just a quick one, for example, suture removal. It's really short. The assistant's going to bring them back, take out the suture. If it looks great, they're going to tell them it looks great and schedule the next appointment. If it looks a little funky, they're going to say, "Okay, let me go get doctor. He's going to come take a look." So they don't come get me unless there's something that looks like it's a little off. So, but that's for the reason of keeping me from getting up from my chair. But that's a short one. Our new patient movement sequence is very long. I think it's like 5 or 6 pages. And we update it with the hygienist every now and then. We change things.
I love this. I absolutely love this because I have my own, of course. I just
Mm-hmm.
call it the SOPs, but
Yeah.
I talk to so many people, and everyone is like, "Can I have your SOPs?" And I say,
Yeah.
"Well, it's like 4 binders, but
Right.
you need to create your own." So explain the process of creating those, because every office should have them. Most of them don't. Everyone wants to buy one, and I think you
Yeah.
can't buy one because you bring those binders, you give them to your team, and you say, "Okay, I want you to do everything that's in here," and your team goes, "It's not."
Yeah. No, you're so right. And everybody wants to buy them, and you have to make them. I was speaking somewhere, and they asked if I could send my movement sequence. So I sent it to them, but I sent it in PDF. And then they wrote back and they said, "Can you send the Word document?" And I said, "No, you need to write your own. Like, work on it." But I'll tell you, we sat down, we did it a long time ago, and then we just revisited it back in April. And it was me and my one associate, and I want to say 4 hygienists at that point. And it was just a really cool experience because there were things that I would have never came up with that my hygienist brought up. And I told them, I said, we got to do this in a podcast, because like they were just saying like, well, this is what I like to say. And like, they all use different verbiage, but it all had the same purpose. Like, for example, I always want to have them say 3 nice things about the practice. And I don't care what it is. It can be, we've been open this many times. It can be, we have this, but I want them to start explaining to the patient who we are brand wise. But we kind of just went from start to finish. We said, what do we want to happen? And let's get it in writing. And then we made a draft, and then we all sat home and everyone wrote on their drafts, and we came back a month later and we did it again. And now I think we did that for 3 months before we revisited it again, and then we updated it again, and we haven't touched it for a while because I think it's pretty good. But it's been nice because now we've hired more people. We have new hygienists. So now everyone's getting on the same page, and we're standardizing that consistency that the patients crave in our brand, and it's what makes us really good.
That's so important. This is so important, consistency, because, what I found is that I am not unique. There are other people who can do it better than me, but my patients don't mind seeing another person as long as they're getting the same experience, right?
Right, exactly.
And that's why we're afraid to delegate, because we think that no one else can do it. But if we write it down, then, coachable people can do the same thing.
Right.
And I love what you said about calibrating associates earlier. They need to treat and plan the same way we do. They need to sound, when they present treatment plans, the same as we do. And then we can take that long vacation and be away from the practice and not worry that things are going to fall apart and patients will leave. That's so critical. And I think that having your team involved in writing those manuals or SOPs or the playbook, whatever you call it, is important, because people support what they help create.
True.
And if they're part of that, then they'll support those SOPs, and then it's so much easier to train more people.
Gosh, that's so true, and I've never even thought of it that way. But it gets a lot of better buy-in because they helped create it. Yeah,
exactly.
It's awesome.
So, what's coming up for you? What are you excited about now?
Oh, what's exciting? Oh, the holidays are coming, and it's getting cold, and the days are getting shorter, and the time change is coming. So I'm not really excited about any of those things, but I'm speaking at Voices of Dentistry this year. I'm excited about that. I also, with my podcast, I found somebody to edit it. So that's going to save me about 3 hours a week, which I'm really excited about that. So now I'm going to be able to do more episodes. I just started doing, instead of doing an interview, I was releasing every other week. So now I'm doing an interview one week, and the next week I'm doing just a 5-minute segment of just me talking. And I'm excited just about growing the podcast, doing more with that, getting more out there, speaking more, just being more of an opinion leader. Not because I want to be standing on top of the mountain telling everybody how things are done, but just really like talking dentistry with people. And I have people like call me on Facebook, or they'll message me on Facebook all the time, and I've never met these people. And I have phone calls with them, and it's just, I really enjoy it. And I don't know if I would ever do consulting, because I'm not sure I want to make that a career, but I like helping people, and I like teaching people what I've learned and what works well for me. And I'm still learning as well. I mean, we always still learn. So I'm excited about that.
That's excellent. And I'm looking forward to hearing your presentation at the Voices of Dentistry. Last year was a blast. And
it's so much fun.
Yes. And I'm sure this one, are you also going to be podcasting from there?
I don't think I'm going to podcast, but I do have a booth.
Okay.
So I'm just going to be talking to people. I haven't decided if I want to record podcasts. Maybe I will. Let me think about that. Let's just say maybe. I still got a few months.
How did you get into podcasting in the first place?
Boredom. Same thing I get into. So what are we going to do next? I've always been saying I wanted to do it, and I wish I would have done it when I originally wanted to, because there was so little podcast out when I wanted to do it. I wanted to start this like 3-4 years ago, and I just didn't feel like I had enough to offer until I wrote my book, which I realize now in retrospect, I could have totally have done it. But that was just kind of what I was feeling, that almost like imposter syndrome. Like, who are you to sit on a podcast and talk to people? Like, you've done nothing. You've got a 5-out practice in almost in the rural Chicago area or suburbs of Chicago. So, and then eventually I just said, I'm just doing it. It's going to happen. And then took it, wrote out the goal, broke it into steps, made a list of guests, wrote all the equipment I needed, and just started doing it. And that's how things happen. And then you get comfortable doing it, and then you look back and you say, wow, look at all I've done. Wow.
That's incredible. I love that. And so we're kind of getting close to the end, but what I'm hearing from you is here's Paul's success formula. You come up with a goal, you write it down, then you hire people that you can trust, and you delegate stuff to them.
Mm-hmm.
And you sometimes you have more time for your family, sometimes you need more time for your work, but in the end, it all kind of works out and balances out. Is that
That's me. That's what I've done. It's that easy. Why can't we all do that?
You certainly make it sound easy.
Oh my gosh. Do you like my original book title was "Why Does Your Practice Stink When It's So Stinking Easy?" And they're like, you cannot name it this. I'm like, but it is easy. And they're like, but you wrote a book. It's really not. I'm like, you're right. It's really not. But when you think about it foundationally like that, when you break it down to that, I mean, that's really all it is. So that's cool.
I love that. Well, I think everyone should run out and get your book. Well, don't run out. It's on Amazon.
Run. Get it.
Get it. It was a blast talking to you. Thank you so much for taking the time to do this. And I'm looking forward to seeing you at the Voices and, wishing you another, great, successful year, great time with your family. Happy holidays, and talk to you soon.
All right. Thanks, Gina. And I got to say that I love your posts on DSN. I love reading everything that you contribute. And we are a new Yapi customer, I think, for the past 3 months, and we've been loving that as well.
Oh, thank you. That's right. That's right.
Yeah. Thank you for all the great things you're doing as well. And it was very fun being on the podcast.
Thank you.